Go.
Isaiah, how's it going?
Doing good, how are you?
Good. So my name's Jared. I'm a student physical therapist at Ragnar University. Today I'm going to be taking you through just a couple things. First, we're going to start off with lung auscultation. So we're just going to be listening to all the lobes in your lungs from the front and the back. Then I'm going to teach you a breathing technique that I think is going to be beneficial and help you out. We're going to teach you a different type of way to cough to help get that mucus out that's less painful for you. And then we're going to end with a postural airway clearance technique to help clear all that gunk out of your lungs. Any questions for me at all?
No, it sounds good.
All right. Throughout the exam, I'm going to be having my hands on the shoulders, chest, kind of the rib area, just while I'm feeling for those spots of the lungs and while I'm doing my clearance technique. Is that okay?
Yeah.
Perfect. So what we're going to start with is that listening to the lungs. That's best done on skin with the stethoscope here. So what I'm going to have you do, would you be comfortable removing your shirt while I listen to those lungs?
Yeah.
Perfect. So we're just going to listen to the front and the back side. We're going to start up at the apex of the lungs on both sides, work our way down to the superior, middle, and inferior lobes. All right. What you're going to do for me is just take some deep breaths in and out through your mouth. So deep breath in and out. Good. One over here. To the upper lobes. Good. Now towards the middle lobes. And the lower lobes. Last one here. All right, those all sound great. We're going to move on to the back side here. Same thing, I'm going to have you take those nice deep breaths in through the mouth and out through the mouth. Starting with that same pattern again. Down. Good. In. Pause. Now the upper. In. Middle. In. In. Out. And the lower lobes here. In. Out. Last time. In. And out. Good job there. If you're listening for that normal kind of breezy, windy sounds, paying attention to see if we hear any crackling or any kind of blockage in there at all, which we sounded pretty good. All right, so you can put your shirt back on if you like. Next thing we're going to work on is a breathing technique. We're going to teach you some diaphragmatic breathing. Have you ever heard of that before? All right, so what we're going to do is we're going to focus on using our diaphragm to breathe instead of our chest. So I want you to put one hand on your chest, one hand on your stomach, whichever one you want. We're going to do this in seated. You could do it supine or standing as well, but for the purpose of video, we're going to do it seated. This is going to help work on decreasing the amount of work it takes to breathe, and we can also reduce some stress and your respiratory rate as well. So what I want you to do is we're going to breathe in through the nose for 2 seconds, focusing on trying to really fill that diaphragm up and kind of expand our hand outwards. And then we're going to breathe out through the mouth for 4 seconds. All right. So breathing in through the nose, ready? 1, 2, good. And out, 2, 3, 4. One more time, really get that breath out. In, 2, and breathe out. 1, 2, 3, 4. Awesome, looks great. Any questions on that?
No.
All right. The next thing we're going to do is I'm going to teach you a huff cough really quick. So the huff cough is going to be a way that we can avoid having that harsh K sounding cough, which is really painful and can hurt the chest, and it's not very good for the lungs either. So what I'm going to have you do is we're going to grab a tissue just in case we have any of that gunk come up here. We're going to make an O with our lips, and we're going to make a sound like we're breathing and fogging up a mirror, so more of a type sound instead of that K. So what I'm going to have you do, we're going to do that diaphragmatic breathing a little bit again. So we're going to think about doing the 2 in, 4 out, and if you have any of that mucus kind of coming up there, feel free to take the tissue and right into it there. All right, so we'll go in for 2 again. 1, 2, and out through the mouth. 1, 2, 3, 4, and that huff cough. Good. How'd that feel? Good. All right. Last thing we're gonna do is we're gonna do some airway clearance technique. We're gonna get you laying on down here, so I'm gonna get the table set up real quick. All right, you can lay down right on the table here. This will just simulate that Trendelenburg position, even though we can't with our tables very well. All right, the right hand up overhead here. Perfect. This we're gonna work on that middle lobe where you're thinking there might be some congestion there. So what I'm gonna do is I'm gonna do some percussion. I'm just gonna be tapping with my hands cupped right over that position, try and clear out that lung lobe. If we were doing a normal postural one, we would do this for 10 minutes. Traditionally, we do 3 to 5 with percussion, but I'm going to demonstrate for just a couple seconds here for the purpose of the video. If you need to have get any of that mucus out there, you have your tissue right there, and you can do that huff cough for me. Are you ready? Mm-hmm. All right. Good. We'll go about 10 more seconds. Feel free to keep trying to huff that out. All right, and you can sit on up. And that was our airway clearance technique for that right middle lobe there. We're all set.